Leanne Upiter-Beer knew something was wrong. For weeks, the 49-year-old preschool principal had noticed disconcerting changes in her right breast.
So I kind of went in for my mammogram knowing that I had breast cancer. I could feel it. I knew that that was what had happened.
She was right. Hers was an aggressive, advanced form of breast cancer. A few days later, she started 6 grueling months of chemotherapy. Now that she's recovered, she takes steps to avoid catching coronavirus.
I am still very cautious. You know, when anybody's with me, they say, "My God, how many times do you sanitize your hands?" And I go, what have I got to lose? You know, I need to just sanitize my hands. And I don't worry to say to somebody, please put your mask on, you know, or, you know, can you just sit a little further away from me?
Medical professionals stress that South Africa's battle against breast cancer continues even as the pandemic rages. Dr. Sadia Laher, who worked at a breast cancer unit at a government hospital, says awareness and screening have improved, but more work needs to be done.
We certainly have a better pickup rate of our cancers as well that has come to the fore with our increase in screening and awareness. Having said that, there's a lot of risk factors that have also changed, making breast cancer more common.
But Laher says there's good news.
There's also been changes in how we manage breast cancer and what we can do technological improvements that have allowed us to manage and treat early breast cancers differently.
South Africa is one of the world's most unequal societies, and the health system makes that abundantly clear. Upiter-Beer says free screening is important, but she also worries about breast cancer patients who don't have the resources needed to recover.
I think it is that post-cancer treatment, that support, that's where the meat of your recovery is. It's not a very glamorous term, but I feel that makes a big difference to a woman.
Shortly after the school principal was declared cancer-free, the coronavirus pandemic landed in South Africa. She now faces the task of rebuilding her immunity while also safeguarding the 70 small children in her care. She says she's thrilled to be back, even though she knows that her job poses health risks. For her, it's a daily reminder of how precious life is. Anita Powell, VOA News, Johannesburg.